Assalamu alaikum friends. Continuing our topic, that is heart failure. Types of heart failure. Let's continue. Left ventricular failure. It is a failure of the left ventricle to propel blood forwards to meet the physiological metabolic demand of the body, resulting in accumulation of blood in pulmonary circulation. So left ventricular failure is nothing but when our left ventricle is unable to propel, unable to uh, throw the blood out of the heart and supply the need for peripheral part of the body. So it is not doing its work. So the blood is going to accumulate in the pulmonary circulation, means the lungs, in the lungs. So the symptoms which we see, if the blood are blood is accumulating in pulmonary circulation, what are the signs and symptoms we are going to see? And these are paroxysmal nocturnal dyspnea, means at night time suddenly there is a rush of blood into the lung, there is accumulation, and there is breathlessness in the night. Gallop rhythm, the pulse rate will be irregular. Pulse alternates beat, one beat missing, one beat missing, one beat you will see. Basal crepitus, if you rub two papers, friction, the voice which come will be known as crepitus, basal crepitus. Now causes for left ventricular failure are hypertension, which is the most common cause. Coronary thrombosis is nothing but clot formation. Thrombosis is nothing but clot formation in the coronary vessel, that is in the heart. Aortic valve disease, mitral incompetence, coarctation of aorta, means there is a narrowing. Coarctation means narrowing of the aorta. Cardiomyopathy means enlargement. Alcohol, carditis, inflammation of the heart. Hypothyroidism, chemotherapy, radiotherapy, obesity, thyroid disease, severe anemia, pericardial disease. Now let's see the clinical features. What we will see first is the most common, dyspnea. This is due to pulmonary venous congestion resulting in pulmonary is nothing but lungs, means pulmonary means lungs. So there will be pulmonary stiffness with diminished pulmonary compliance, with stimulate the Herring-Brewer reflex, resulting in rapid and shallow respiration with accumulation of carbon dioxide. If the blood is not getting out, there will be accumulation of carbon dioxide, because there is difficulty in breathing. So because of accumulation of carbon dioxide, there will be this will be resulting in rapid and shallow respiration. It first occurs on exertion, means it first occurs only on after exertion, after overworking, after exercise, and then ultimately it will occur even at rest. Dyspnea on exertion, in early stages patient feels out of breath only during heavy exercise. This stage is called compensated stage. Dyspnea at rest may be paroxysmal and often nocturnal. At midnight, patient suddenly wakes up, sits up in bed, or rushes to window and feels suffocated. So the patient have will be gasping for air at night, opening the window for fresh air to come in. So he feels suffocated. Second symptom is nothing but cough and expectoration. This is also due to pulmonary congestion with pulmonary edema, and therefore it occurs after exertion in early stages. During acute attack, patient has cough and brings out lot of sputum, sometimes hemoptysis. Hemoptysis is nothing but coughing up with blood, sputum with blood, mix up with blood. So third is palpitations. Generally palpitations is there when there is a heart is trying it's hard to pump out the blood, so there will be increased heart rate. So palpitations means the sound will come. Perspiration generally will be there. Cold clammy skin, often drenching the garment, may be seen, which is due to excessive catecholamine secretion. Other symptoms will be general symptoms are usually elderly males above 40 years are affected. Decubitus is propped up as in this position. The cardiac output is less. Face is anxious and sweating may be present. Cyanosis is present and is central in type. It is due to defective oxygenation of blood in the lung due to poor diffusion of oxygen from edematous alveoli. Edematous alveoli is nothing but alveoli is present in lungs. So, because of the accumulation of the blood in the alveoli becomes swollen. So, because of that, there will be poor diffusion. Diffusion means exchange of oxygen and carbon dioxide will be disturbed. So, there will be dyspnea. Cyanosis because of accumulation of carbon dioxide, excessive accumulation of carbon dioxide in the lungs, and is due to mismatched pulmonary ventilation. Respiration is hurried, pulse rate is always high and above 100 to 120 beats per minute. Blood pressure is increased. Examination of heart shows apex beat is more down and forceful on palpation. S3 and S4 heard. Basically, normally S3 and S4 is not heard, but in this condition S3 and S4 is heard. Basal crepitation, investigation, X-ray of the chest. We will see butterfly shadow due to pulmonary edema. ECG, left ventricular will be enlarged. Echocardiogram shows abnormality. Radionuclide ventriculography, regional wall, chamber size and ejection fraction will be seen by radionuclide ventriculography. Cardiac catheterization. Differential diagnosis we will be seen as asthma, cardiac asthma. Treatment, rest in bed in propped up position, oxygen inhalation, diuretics, vasodilatation.